going to go ahead and start recording this press event so we can share it with some friends in the future. Again, my name is Kelsey Berkfield. I'm the Director of Advocates for Ohio's Future. I am joined by a number of our partners at Advocates for Ohio's Future to talk about really the American Rescue Plan Act, specifically these flexible state federal recovery funds that Ohio received over $5 billion of these dollars earlier in this year from Congress. We received the first chunk, about $2.7 billion of these dollars in the spring of this year. Right now, we have about just over $600 million of those funds left. Again, it's up to the state to use to really recover from the coronavirus pandemic and resulting economic downturn. We really know that the legislative intent from Congress for these dollars was to make sure that states can support a strong and equitable recovery from the pandemic, and really make sure that we kind of target these dollars to keep our state moving forward, recovering, as well as making sure we're really reaching those folks who are directly impacted by the pandemic. So given that we are coming to the end of the year, we wanted to, in the spirit of giving, think about different ways that the state could use these dollars, the remaining funds, both the over $600 million left in the first allocation and the $2.7 additional billion that are coming at the beginning of 2022, and how we can target those funds, again, to support people as we continue to recover from the pandemic. So today you're going to hear again from our experts, from our AOF partners, to discuss really what Ohio has spent those funds on, how other states have been using their dollars, and then really kind of talking about the needs that still remain throughout our state and how we think maybe we can move forward together, both as stakeholders, as health and human service advocates, and to also include really folks around the state in the planning for these dollars in a transparent process moving forward. So without further ado, I very quickly would ask if you have questions during our first few minutes here today. If you feel free to enter them in the chat function, or at the end, we'll of course open it up to questions. Feel free to unmute yourselves, and we'd love to hear from you. So I will go ahead and introduce our first speaker. We have Zach Schiller, the research director from the Policy Matters Ohio. Zach, when you're ready, please take it away.
Great. Well, thanks so much, Kelsey, and I appreciate all of you joining us here this morning. I'm going to talk briefly about just 3 points: how the money has been spent, how it was done, and what some other states are doing in this area. And we're talking here about the state flexible funds that are available, as Kelsey mentioned. The General Assembly has appropriated more than $2 billion of Ohio's flexible state funds through 2 different bills, House Bill 168 and 169. In both cases, a completely different bill that had already passed the House was stripped of those provisions in the Senate and appropriation authority added in. The only public hearings, and I'll put that in quotes, in each case were a 10-minute Senate committee hearing with no opportunity for public testimony, in which details of the bill were described briefly. Once the full Senate acted, the House simply had to concur because technically it had already approved a form of the bill, even though what it passed had no relation to the final bill. Basically, this means that the public had no part in this whatsoever. And what we need is a far more transparent process in approving the remaining $3+ billion in flexible state funding. Okay, so where has the money gone so far, or at least been appropriated? We have $250 million that's being spent on water and sewer quality. We have $84 million on mental health and addiction pediatric behavioral health facilities. We have $1.47 billion spent on bailing out the state's unemployment insurance trust fund, which was in debt to the federal government by that amount. And we have $250 million in the latest tranche in House Bill 169 for law enforcement and first responders. So total, we have $2.05 billion so far, and I think there may be a small amount further on today's controlling board agenda. Altogether, that means that the bailout of the unemployment trust fund accounted for 71% of Ohio's spending. That compares with just 15% nationally, according to a recent study by the Center on Budget and Policy Priorities, which I think you've probably seen. Only Texas has spent a greater amount, and only New Mexico and Kansas have spent a greater share of their ARPA dollars on the UC bailout, even if many states have done that to some degree. What will this actually accomplish, bailing out the unemployment trust fund? What it will do is keep businesses from seeing a tax increase, not now, but in 2023. This is not real COVID relief, and it does not boost hiring or the state economy now. So moving on to what some other states have done here. We took a look, and you can look yourselves if you'd like. The National Conference of State Legislatures has compiled a lot of it, as has the Center on Budget and Policy Priorities in the report I mentioned. But just to cite what a few other states have done to actually meet needs and actually provide COVID relief. Texas is spending $100 million on food assistance, including $95 million for providing supplemental funding to food banks. Illinois is spending $103 million on housing assistance, including supporting construction and rehabilitation of affordable rental housing in areas most impacted by the pandemic. Indiana is spending $250 million on a rural broadband fund. Iowa, $100 million to address the state's housing shortage. Kentucky is spending $50 million on increasing broadband access and $69 million for public health. West Virginia, $16.4 million on senior centers for meal programs. This shows that in other states, we are seeing them use important amounts of this money to actually provide for the major human needs that have not been addressed. And so we need to make sure that the people who are hit hardest, who are being left behind, are in fact targeted for assistance. We've so far spent a huge proportion of our funds to stabilize businesses. We need to spend the remaining funds on those who are most in need. Okay, so I'm going to go now to Lisa Hamler-Fugitt from the Ohio Foodbanks, who will fill you in on some other elements of this.
Thank you, Zach, and good morning. I'm proud to serve as well as on the Executive Committee of Advocates for Ohio's Future and to work in partnership with health and human service organizations and advocates from across the state. Thank you for joining us this morning. As representing Ohio's largest charitable response to hunger, our 12 Feeding America food banks and some 3,700 member charities, our statewide network last year served 3.8 million households, more than at any time during our 30-year history, providing over 290 million pounds of food and groceries. The holiday season is often a time for us to reflect on our blessings. And as human service organizations and communities of faith, we come together to charitably provide for the least among us, often through robust food and toy drives. And we thank the individuals and businesses that offer their philanthropic support in the season of giving. Unfortunately, the number of Ohioans seeking assistance to meet their basic needs is continuing to grow. As low-wage earners, seniors, and people on fixed incomes struggle to fight the effects of a persistent pandemic, and now the impact of rapidly rising cost of food, fuel, housing, utilities, medicine, and the everyday cost of living that is being driven by inflation and supply chain challenges. Charitable giving alone cannot address these growing and widespread disparities. As Zach said, we're here to speak specifically about the state recovery federal dollars that are available. As we know, many other states and local communities have reached out to their residents and partners to identify and prioritize the needs of their communities through open and more transparent processes before deciding on strategic investments to support a full and equitable recovery. However, the state of Ohio has expended more than 3/4 of its state fiscal fund allocation with no public input. Think about that. These are incredibly significant dollars entrusted to our state government. The U.S. Treasury has explicitly encouraged states to help people, those most affected by the pandemic, and to address the racial and economic inequalities that predate but were worsened during the pandemic. And in fact, at last count, 22 states so far have devoted funds to human service programs such as cash aid, housing, social services, and yes, food assistance. For 20 months, I have witnessed the direct impact of the pandemic on our most vulnerable citizens. Our network serves now a de facto grocery store for many families, seniors, and communities, providing take-home groceries to nearly 1 million Ohioans every month. Our food banks remain extraordinarily grateful to the Ohio National Guard for their 16-month deployment, which ended on July 2nd. The hard work of those soldiers and airmen and the equipment and other resources they provided to help us not only to stay open every day of the pandemic, but to do more and be more than we could have ever imagined to our hungry friends and neighbors. Now we find ourselves desperately fundraising to keep up with historically high food costs and sharpening decline in food donations while navigating a supply chain under immense pressure. We have had to increase our workforce to meet the challenges in our communities are facing. We don't have enough refrigerated trucks or truck drivers to drive them, and we need more infrastructure to get the food out to rural communities and isolated households. And we can't possibly keep up with purchasing food at these unpredictable levels we are at right now. This is not sustainable for us on our own. Some people may think that this pandemic, its an impact on the economy has subsided, but I'm here to remind them that it is only just the beginning. This is a once in a lifetime crisis that is escalating once again in our state. We must continue to value the health, the safety, and security of Ohioans above other interests. Last spring, the people who work at our food banks were desperately overworked and afraid for their own lives. We took every step that we could to protect them and reward them for their diligence and sacrifice, and we worried. We worried that the food would run out, we wouldn't be able to keep up, but we were also encouraged and we were so moved by the outpouring of goodwill from our elected officials. We felt motivated to keep pushing, to figure out how to add another delivery route, to find one more truckload of food, because we felt that our communities, including our elected leaders, had our backs. It pains me to find ourselves here now, talking to you about what seems like common sense, that our state should listen to the people harmed and continuing to be harmed, and the organizations and agencies that are helping them as they make decisions about how to use our federal tax dollars to help us. It feels like a betrayal. There are plenty of examples already of states using their ARPA dollars to serve people, fill unmet needs, and build resilient systems that are prepared to withstand the remainder of the crisis and future crisis. As Zach highlighted, I'd like to add, Utah allocated $17 million to establish 2 new food banks, including those on the Navajo Nation, another $90 million to support mental health facilities. Pennsylvania's already invested $300 million in its social services, and Wisconsin has already allocated $100 million to health and human services. North Carolina, Arizona, Michigan, and Massachusetts are investing hundreds of millions of dollars in food banks, food security initiatives, and for children and seniors, capacity building and infrastructure to support purchases, the emergency food, and personal care services. Other states are investing in housing assistance and eviction protection. Connecticut is devoting money to legal services to help residents fight eviction, and Washington State has provided over $400 million to cover past due rents. Colorado is investing $130 million into affordable housing. Again, the Association of Foodbanks has our own request as we have advanced a full and thorough platform of health and human services request to the governor and to the General Assembly in October. And I urge you to review those carefully for wise and strategic investments. We are asking for a chance to present our case and explain the real needs of our communities and those that are facing these unmet needs in our communities. There is still time to approach this process in a more transparent and responsive way. There is still time to treat these funds as vital catalysts in the recovery and resilience in the months and years ahead. I urge the governor and leaders of the General Assembly to give impacted people like those we serve in the impacted sectors like ours a seat at the table as they make future decisions about how to invest these funds. And in closing, we again offer OAF's current and comprehensive and thorough health and human services priorities as a blueprint to these elected leaders and urge them to invest the state's remaining American Rescue Act plans in a targeted and proven supported programs and services to all Ohioans who are still struggling. At this time, I'd like to turn it over to Susan Jagers from the Poverty Law Center. Susan.
Good morning. Thank you for joining us this morning. I'm Susan Jagers, Director of the Ohio Poverty Law Center, and I serve on the Executive Committee of Advocates for Ohio's Future. The American Rescue Plan Act is an extraordinary response to the devastating health and economic impacts of the COVID-19 pandemic. It is also an opportunity to begin undoing longstanding racial and economic inequalities that the pandemic exposed and worsened. How our elected officials choose to spend these funds and what complementary policies they put in place for the long term will make a crucial difference in limiting pandemic-induced hardships and building a more equitable recovery. As Kelsey noted, Ohio has already spent 3/4 of its first state recovery fund payment, with $600 million left and $2.7 billion that will come to Ohio in May. Ohioans deserve a say in how the money is spent. This historic opportunity to invest in people, communities, and infrastructure deserves a robust planning process drawing on experts, state and community leaders, and people most harmed by the pandemic. The spending of the state fiscal recovery funds should complement and support the American Rescue Plan's other funding streams, maximize other federal and local resources, and take a long-term view for recovery. The rescue plan itself includes important reporting and public engagement requirements to help residents and organizational stakeholders influence the use of these fiscal recovery funds. Ohio can and should do more to engage the public in its decision-making and review process. As Zach outlined, to date, there was no opportunity for public input on how Ohio has spent the money so far. We ask that the governor and the General Assembly establish a transparent public process for determining the best use of these funds for an equitable recovery for all Ohioans. Additionally, it'll be critically important to evaluate how these funds are used for return on investment and how they supported health and economic recovery. For example, the legislature could establish a joint committee to oversee the planning for the federal funds. Such a committee could assess where investments are most needed, gather input from the public, ensure coordination among funding streams and opportunities, and evaluate and monitor those investments. Ohio can make meaningful improvements in the health and stability of low-income and marginalized communities. As federal dollars from the recently signed Bipartisan Infrastructure Investment and Jobs Act begin to flow into Ohio, policymakers should pay close attention to the needs of underserved communities when considering where to make long-term investments in hard infrastructure, like repairing decaying roads and bridges, replacing aging water lines, and closing the digital divide. With these multiple resources, the public planning process is even more important. As a coalition of health and human service organizations, we stand ready to assist Governor DeWine and leaders in the General Assembly as they prioritize strategic investments to ensure a fair and equitable recovery for all Ohioans. The unprecedented opportunity presented by these landmark bills deserve a well thought out plan to ensure investments are addressing Ohio's most urgent needs. And I will turn it back over to Kelsey.
Thank you, Susan, and thank you to all of our AOF leaders, Zach and Lisa and Susan, for joining us today. So at this time, I would like to open it up to questions for folks on the call. Please feel free to unmute your mic and speak freely, or as always, submit any questions through the chat function or Q&A. So the table is open. We'd love to hear from you.
It's Joe Ingles. Can you hear me?
We can.
Oh, okay. I was wondering, I think that the state leaders, I'm not trying to put words in their mouth. I'm trying to think of how they would word this. I think they would think that all that money that they've put out was actually saving taxpayers money because it was going for things that taxpayers use, and that it has an important public service because, the businesses right now are hurting and taxpayers are hurting. They don't have extra money, and they would see it from that angle. What about that?
Looks like we might have lost Zach, who I thought might answer that question. I will just say that I think there are lots of needs that Ohio has. And I think part of our concern is that there's been no public debate about what the best use of the money is. I think we can highlight from the Health and Human Services perspective the needs in communities and where we think investments are important, but making decisions without a public process, I can't say what the highest and best need is of these dollars because we haven't had that public process. And certainly we think investments in health and human services is a high priority and should be a consideration.
Hey, it's John Reed from Gongwer. Can you guys talk a bit about the timeline, both for the money and the urgency of getting this money to where it's needed now?
John, this is Lisa. I would say the urgency is now. We are extremely concerned that with rapidly rising cost of living and inflation, that those who are living on fixed incomes or low income are not making ends meet. We are also looking at the potential sunset of the child tax credit if Congress fails to get Build Back Better through, and a continuation of those child tax credits that are helping more than 2 million working and in low wage Ohioans support their children. So the urgency is now. Certainly there appeared to be an urgency to get these dollars appropriated and out the door last week. So again, we have laid out what we believe to be a very robust and thorough and comprehensive set of proposals for the remainder of these recovery funds, and look forward to the General Assembly working through that process now. Certainly with the increasing number of cases that we're seeing really day to day with this COVID, there is a lot of uncertainty right now in some of the strides and improvements that the economy has shown, certainly with low unemployment, record levels of low unemployment, that the last thing that we want to happen is that the economy stalls because people are unable to continue to consume at the rates that they are. And we again are talking about the 1 out of 3 Ohioans who don't earn enough to meet their basic needs and are living at levels of self-sufficiency, but on incomes at or below 200% of the federal poverty level.
This is Titus with the Columbus Dispatch. I just wanted to get kind of any one of your thoughts on a portion of the most recent bill that was passed on this. It set aside some of the money to kind of go toward the kind of provider relief payments to nursing facilities and other healthcare providers. Specifically with 300 million of them going to nursing homes. But it does, require that money be going toward, the workforce. I'm curious if you think, what your thoughts are on that portion. Do you think that will actually help Ohioans, and especially older, vulnerable Ohioans, or do you think that doesn't go far enough, or just any thoughts?
You know, others may have more to say on this, but I think that that is separate from what we've been discussing at the press conference, in the sense that we've been looking at, as Kelsey put in the chat, the money that's going to the state for flexible spending, where the state has a great deal of discretion in how it determines what it's spending. And I don't believe that, I think the only money that was approved in the most recent tranche was the 250 million for first responders, and the rest of it, you know, there's a large amount, much larger amount actually in ARPA money coming into Ohio for dedicated purposes, for education, for all kinds of different things, which is, you know, a great thing that we're receiving these supports, broadly speaking. What we're talking about here is that 5.36 billion that the state is receiving, where it has broad discretion.
I agree, Zach. Thank you. And Titus, I think we're very appreciative of the guardrails that were put on some of the dollars that were allocated to nursing facilities and other healthcare providers, to again ensure that those dollars are going to go directly again to those frontline workers, to our caretakers, to our direct care providers. We're excited to see those guardrails put up, and we're encouraged in the direction that those funds were spent. Again, they were not from this specific funding stream that we're talking about. I think they were a conglomeration of unspent federal dollars from the past, as well as the enhanced federal match for Medicaid. And so those investments, again, happy that they're there, but again, a lot of really what we're talking about today are those remaining really flexible kind of state funds, about 600 million in the first allocation. And again, we've got another 2.7 billion coming.
This is Danny Eldridge with Hannah News Service. So my question is just 600 million in the first tranche. Is your position that 600 million should go to these like health and human services like as soon as possible, and then have a committee do the rest of the 2.7 billion, figure out the best way to get that out? And does the General Assembly have to meet? Because the House is not meeting, or isn't supposed to meet the rest of the year. So what kind of timeline do you think, we'll get on the 600 million?
Those dollars are in the hands of, the state right now. And, as Lisa said, we have outlined a plan for how we think those dollars should be spent. And, the General Assembly made some other things a priority. We were hoping that they would have made health and human services a priority, and are calling for them to do that. And then knowing that the remaining $2.7 billion will be coming to Ohio in May, it gives some time to plan for the best use of those dollars, and really the coordination of some of those other funding streams that we've talked about from the American Rescue Plan and other bills that are being passed. But certainly there are high needs and urgent needs right now, and Ohio does have that $600 million that can be spent now.
And Danny, there is we're not coming up against a deadline to allocate those funds at the end of this calendar year. We still have some time for those $600 million to think about, again, where they can best be spent, either by committee, by public process, or you're right. Again, we still have $2.7 billion with a much longer timeline for allocation and spending for that consideration. But there is no deadline at the end of this calendar year to allocate that remaining $600 million. Any additional questions before we thank you again for your time and your attention this morning. We are, as always, available for additional questions or follow-up at the conclusion of this event, but we want to thank you for being here, especially on a Monday morning. I think that does it. Thanks again for your time, everyone. We will, again, keep our eye on the rest of any allocations for the American Rescue Plan Act, these federal fiscal funds coming at the beginning of next year. We doubt that there'll be much legislative activity before January. We do know that there's a request or two on today's controlling board agenda for a small amount of those funds, but we'll keep our eye on it, and as always are available for questions later on. So thanks again for your time and attention this morning. Have a great and safe holiday season, and we'll talk to you soon. Thank you.
Thank you.
Thank you.